What age should you consider getting your first colonoscopy? What risk factors can increase the need for more frequent testing? I'm Dr. Vincent Petros. I'm a staff gastroenterologist at Norman Regional Health System. And it's my pleasure to discuss further about colon cancer screening and answer some frequently asked questions. Someone average risk without any family history or personal history or symptoms is 45. Well, it actually used to be 50, but not too long ago they lowered it. We're struggling to keep up with younger individuals getting diagnosed in more advanced stages of colon cancer. So this is our effort to keep up with that. A man's risk of lifetime colon cancer is 1 in 24 compared to a female is 1 in 26. That's almost 4 to 5% of every American walking around down the street. What we've learned actually is a 45-year-old undergoing their first colonoscopy has the same risk of a 64-year-old who is going their second colonoscopy, developing a precancerous polyp. A portion of that is genetics, a portion of that's environment. We're here in Oklahoma, in the Western Hemisphere, breathing the same Oklahoma air and water and food. So red flags, alarm signs, warranting further evaluation would be things like visible blood loss, bloody stools, black stool, bright red blood per rectum in the stool, low blood counts we refer to as anemia, unintentional weight loss, first-degree relatives, parents, siblings, children with family history of colon cancer. These all warrant further evaluation. Something to keep in mind, though, is screening, by definition, is preventative health or proactive, meaning you're not demonstrating symptoms, and we do something to screen in the absence of symptoms. If we wait for symptoms, that is diagnostic, meaning we're reacting to a sign or symptom that's manifest outwardly. And so our goal is to be proactive, preventative, because a lot of times, if there is stage 1 or stage 2 cancer, more often than not, is not symptomatic until it's spread and late, stage 3 and stage 4. A lot of times it's not curable in that state. And so our goal, majority of the time, is if there is a cancer, to catch it in early stages while it's manageable, treatable, and curable. The second most common in America is colon cancer deaths, and that's increasing, right? So if we do catch a colon cancer, that's early stage, 5-year survival is up to 90%. Most people will live and survive and beat that, whereas the opposite is true. If we wait until you have symptoms, and we're getting it to the point where 5-year survival is low as 12 to 16%. So majority of those individuals will not be alive in 5 years. And so that's something we have an ability to directly alter, hence the importance of prompt screening before the onset of symptoms. Frequency is tailored according to a person's risk factor. And so we talked about someone that's average risk, meaning they don't have symptoms, no one they're related to has history of colon cancer. If they were to have a normal colonoscopy, that's high quality inspection, they'd have a 10-year interval, 10 years before next colonoscopy. Now, if we do find polyps, your risk of redeveloping new ones in the future prior to then is going to be higher. And so they likely have an interval follow within 3 to 5 years. You want to keep up and not give ample time for those precancerous polyps to redevelop. Catching them early is what minimizes the chances of them multiplying, spreading, and transforming. And so that's the importance of such. We can't find disease if we can't see clearly. And so a complete, thorough bowel cleanse is what's most important to permit a thorough inspection by your physician and doctor performing the inspection. And they'll provide a thorough cleansing solution or medication designed to get you completely cleaned out appropriately to permit an excellent and high quality visualization. And just keep in mind that a small inconvenience is definitely worth a peace of mind. Don't wait, get out in front of it, not give it a chance to permit it to grow unabated, unrecognized. I'd strongly encourage anyone to prevent any barrier or obstacle or hardship to get in the way between you and your own preventative health.